If your child struggles with chronic neurological challenges like autism, ADHD, sensory processing disorder, anxiety, seizures, OCD, PANS, PANDAS, and so forth, then it's likely these four things are true for you, mom and dad. Number one, you've exhausted all support from the traditional pediatrician, medical specialist, and medical system, finding little to no answers or helping to find that root cause. Number two, you've been up late at night, constantly scrolling and searching through Facebook groups, Instagram accounts, and websites, looking for that root cause and drug-free approach to help your child. Number three, you've already gone after every diet change, detox, supplement, integrative therapy out there, and yet perhaps your child still struggles. Number four, and last but not least, it's not just the diagnosis you're looking for help with. Every single day can be a struggle. If this sounds like your child, then it's likely you and your whole family are stuck in what we like to call the perfect storm. This is a sequence of traumatic, toxic, and life-altering events that a child goes through early in life, as far back as pregnancy, labor and delivery, and early childhood. These high-stress traumatic events, especially at pre/post-birth, leave the nervous system stuck in a perpetual state of fight or flight overdrive and throws them off track developmentally. We love talking about the perfect storm and explaining it to parents dealing with these struggles because it's one of the first times they truly feel heard. One mom has even said, "It was like you described my child and our journey word for word and step by step." To show you the prevalence of how these struggles are affecting our kids, let's show some stats released by the CDC. 1 in 4 kids have chronic illness. 1 in 6 kids have sensory issues. 1 in 36 have autism spectrum disorder. These rates are exponentially rising at a rate that genetics can no longer be seen as a sole factor, and we're seeing how environmental factors actually play a large contributing role. When talking about the perfect storm, there are a few key points that we need to discuss. First, we're going to talk about the brain trauma and the brain stem. How often have you heard someone say, "Make sure you support their neck" whenever they hand you their baby? This is because so many important functions of the central and autonomic nervous system are housed there. Some of these vital functions that we'll talk about include, but not limited to, digestion, breastfeeding, regulating sensory processes as it relates to vision, auditory, smell, and touch, regulate motor development as it relates to milestones, balance, tone, brain communication to social environmental changes, behavioral, decision-making, and so much more that we could honestly discuss this whole video. But the second thing that we want to talk about is how that relates to the vagus nerve and how it controls these vital functions. As an originating cranial nerve, it travels from the brainstem through the upper neck and makes its way all the way down to the thorax mid-region to regulate breathing, heart rate, and digestion. Its main function is regulating parasympathetic tone, allowing for us to slow down, relax, proper development, focus, and sleep. The problem is when interventions such as C-section, forceps, vacuum, and inductions are done, it creates added stress and has the capability to physically injure the brainstem, which as a result damages the vagus nerve. These interventions are most commonly seen in women who have excessive stress during their pregnancy, which has been clinically documented in over 50% of cases. Stress during pregnancy and birth interventions or difficult births are steps 1 and 2 commonly seen in the perfect storm. Next thing we talk about is the sequence of sickness, medication, and stress. The extra stress during pregnancy and at birth, as we discussed, leads to a common series of events. This is first, fussy, colicky, constipated, sleep-challenged infants. Sensory, constantly sick, challenging baby to toddler stage, needing more antibiotics and anti-inflammatory medications over and over. Constantly wound up, sensory overwhelmed, hyperactive, emotionally stuck children. Then it leads into focus, concentration, organization challenges for grade school children. Next, we see exhausted, angry, anxious, depressed teenagers. And the thing is, the sequence of events shows how stressors early on in life build and compound to further struggles later on. Next, we want to talk about is toxins, though. Traditionally, the only answers to children with neurological disorders are medications. But if you're a parent, you've recognized this as a last resort. You've looked at how to remove these toxins with supplementation, whole foods, diet, and other natural remedies to help you turn that corner. I bet you saw improvement, but you could tell that something is still missing. Just to let you know, parents, you're 100% on the right track in setting your child up for early and better success. However, we can't forget that toxins are just one of the 3 stressors, traumas, toxins, and thoughts that affect our nervous system. When your car is broken, you look at how the engine is functioning rather than replacing the fuel that you're using, as a real life example. Now let's discuss how we've seen and utilized neurologically based chiropractic care to get out of that storm. The effect of these stressors we discussed leads to what we refer to as subluxation, which just simply means stress stuck on the nervous system. Subluxation, especially in infants, alters the most important times of brain development. This is the all-important movement and motor milestones. Without these basic levels of neurological development, it impacts our more complex pathways that relate to speech, emotion, behavior, focus, social, and so much more. So then how do we locate and see where is subluxation affecting the body as a whole? We do these through our state-of-the-art Insight scan technology. It offers us a non-invasive and safe way to measure subluxation, dysautonomia, and alterations in motor tone adaptability, and so much more. These life-changing scans will give you so much awaited hope and answers that you've been searching for, and allow us to understand your child like no other provider has been able to before. When we combine these scans with neurologically focused and specific adjustments, you will see your child's diagnosis transformed into their superpower and see their potential rise to levels you always knew deep down there was possible for them. To get your child out of the storm and on a path of thriving, call or go online now to our website to get them scheduled for their neurological scans today. We can't wait to experience miracles with you and your family.